Collaborative governance and leadership is really thinking about the population that you're serving, and organizations not solely thinking about the operations of what they do, but working together for the patient. So integrating care across organizations, thinking about patient transitions, thinking about patient needs, and bringing the services collaboratively to the patients to meet their needs. So Guelph Area OHT was one of the early adopters and one of the first OHTs approved across the province. There was a separate group working together, the rural Wellington area group, that wanted to form their own OHT. Through direction from the province, we were asked to merge and look at ourselves as a whole and become the Guelph Wellington OHT. And I think our partners have really embraced collaborating, working with the urban center partners, collaborating and working with our rural partners.
Throughout the process of bringing our organizations together, we've encountered lots of different challenges. But I'm happy to say that we as a group have been able to overcome those challenges. We know that there are still more that are going to face us as we continue along with the process. But as trust is developed between all of us as a group, we are able to work together and collaborate together to overcome what might be in our way.
Over the last years as partners, we've really come together as executives and governors to talk about how we work differently. And that really stems from developing really strong, trusting relationships. And we've coined the term radical collaboration as a different way of working together.
When you understand the roots of healthcare, in a lot of cases, there wasn't a lot of collaboration. It was this organization does this organization does this one does this. And there wasn't a lot of overlap or radical collaboration going on within the organizations as a whole.
As we travel on this journey together to redesign our healthcare system, we need to have executives that are working together differently, that are being vulnerable and partnering, that have strong relationships, that are working collaboratively together. But we also need to have our governors join us on that journey and have them at the table so that they can understand that we are no longer just thinking of the needs of our individual organization, but the needs of the population as a whole, and how does our organization fit in that puzzle as we connect and collaborate with fellow organizations.
Across the evolution of the OHT and through various working sessions with advisors, we were able to realize that we were better together as one committee with our voices at a common table, which is how we created the Integrated Care Council. So the Integrated Care Council is made up of governors from each of the partner organizations, as well as executives and patient family advisory committee members.
Working together in this way is new to partners. It's new across the province to have so many people at the table, but we want to make opportunity and space for all voices. Radical collaboration is bringing together services that historically haven't necessarily worked closely together. We're experiencing that in Guelph Wellington with some of our social and our healthcare services.
I've been involved for the past 5 or 6 years now, and we've been able to accomplish more because we trust each other more. And I see that trust only strengthening as we continue down this journey together.
What we've come to learn is that relationships take time and trust takes time, and that through engaging on different projects and collaborating on different initiatives to bring care to different regions, whether it's working to bring specialized care from one of our urban hospitals or co-designing a system across all of our hospitals in Guelph Wellington. We've come to develop those relationships over time and that trust over time. We're learning to hold each other accountable, but also develop that trust and that knowing that your partners have your back and your partners are here to work with you, because we're all in this for the same purpose of improving the health and well-being of our population.
I am just super proud to be involved and super proud of what our community is accomplishing.